I'd have to say from the MyChart application perspective that sometimes I'll find, and I just had a surgical procedure recently, that the information that was provided in my after visit summary was different than what I would have seen if I would have looked or had looked prior to the time of the procedure. And so it was more specific to what it was that was pertaining to my position, my particular situation. So as we all look around for different sources, I think sometimes we still have to come back to what it is that's related to our medical record, even though I know that's difficult sometimes, because that integrates not only what's happened to us at that point, but as in my case, because I have a multiple number of different conditions, it brings all those together and shows the areas where there may be some overlap or areas of concern. Well, I do use smartphone applications. They're ones that are not directly related to my medical condition. I mean, let's see, I have a watch on, and this is probably my 5th version of different technology that I've used to manage my health outside of my conditions. So using it and then integrating that into diet. So I've used ones that are related to my lifestyle, related to my diet, related to my personal health care, and in some cases some of those actually work fairly well together. So all of those for me have helped me continue to see how I'm progressing. I think it's important for us to be able to have our own information every day about our diet and our activity and those sorts of things that we can manage ourselves, and then use those in combination with the other smartphone technology that's provided by our medical professionals. When it's integrated into the electronic record like it is in the MyChart application, then that's really the best way to communicate, because then we can be talking about conditions, we can be talking about prescriptions, we can be talking about other factors that may even be brought in by other medical professionals I'm seeing to actually influence my care. So that's made a huge difference. In the past, what you would do is you primarily have to make a visit to each of those different offices. And in fact, I had one physician who I had been seeing for a long period of time who wasn't on MyChart, and I actually switched physicians because I needed to make sure that all my physicians could see my medical record, and that's something I certainly wouldn't have done in the past. And even though that physician was very personable, was using an electronic record, because it wasn't part of my collective medical record, even though I know they could get a summary from my record, they still could not see the detail that all my physicians could see when they were looking at the same record. And I walk around using that on my smartphone all the time.